And I'm Callie Wolf. I'm the president of Nursing Students for Choice.
And I'm Matthew Wolf, no relation. And I'm the president of Secular Students HSC. And today I think we have a really cool lecture given by the Oklahoma Coalition for Reproductive Justice on kind of the history of reproductive rights in eugenics too, right?
Well, we're talking mostly about healthcare versus punishment.
Okay, so should be hopefully maybe a little provocative lecture, and enjoy.
Yeah, and we are so happy to introduce Tamiya, Caro, and Shannon from the Oklahoma Coalition for Reproductive Justice and Planned Parenthood. And thank you so much for coming.
Thanks a lot.
Hi everyone, my name is Tamiya Cox and I'm staff attorney and lobbyist for Planned Parenthood of the Heartland. We currently have 2 affiliates of Planned Parenthood here in, that share the state of Oklahoma, doing all types of reproductive health care, from well woman exams to STI problem care visits to transgender hormonal care, as well as abortion referrals. Currently in Oklahoma, neither affiliate does abortion care. We've been around since about the 30s. We are the only state, actually, in Oklahoma where the Planned Parenthood does not do abortion, but because of just the history of reproductive justice in Oklahoma, that's probably going to change eventually. So I'm just going to talk very briefly just about the history of reproductive justice in Oklahoma and really what that means. I do want to just talk briefly about reproductive justice, what that model is. That is really just talking about the intersectionality between what we know as social justice issues, how they kind of intersect with reproductive rights, because they very much do, whether it's access to birth control and contraception, whether it's access to education, how those really fall in a model of social justice issues. So we really look at like reproduction rights in kind of 3 ways. So we have reproductive care, which Planned Parenthood does, is offering the type of care that we do. We have reproductive rights that we are all afforded those rights by the Constitution and case law. And then we have reproductive justice, where within the reproductive rights framework, that reproductive justice is not afforded to everyone, whether it's through just racial issues, whether it's through LGBT issues, not being able to receive the reproductive care that they need. So a lot of the times we know the reproductive justice framework is somewhat new to people. We always hear that's my right, reproductive rights. But we really are trying to transition to a reproductive justice model that even though we have those rights, I don't necessarily have access to those rights because of the situation I'm in. But Oklahoma and anti-abortion bills seem synonymous, right? Many of you may or may not be aware of the anti-abortion bills that are passed every year at the Capitol. But that is probably nothing new. We know that in 2010, anti-abortion bills became very, very prevalent just kind of across the country. But in Oklahoma, we've been passing anti-abortion bills really since about the 90s. We do have 2 providers here in Oklahoma, one in Tulsa and one in Norman, and they've been providing abortion care for years. They have been Dr. Burns in Norman has actually had his practice since 1974. So we have a history of having access to abortion care, but really at the legislature we've seen these obstacles to access really come to fruition, unfortunately. So in the 90s we saw abortion care become really a hot button issue on a national level as well. But the bills we were really seeing really had to deal with consent, what it meant to what type of abortions can be provided. In the 2000s, the mid-2000s is really when we saw just kind of this avalanche of anti-abortion bills really focusing, we hear this language of focusing on the health of the woman, for the safety of the woman, when in fact those have nothing to do with the safety or health of the women. By all means, any abortion provider, any doctor, any healthcare professional in Oklahoma that's doing abortion care, doing abortion referrals, the health of the woman and the safety of the woman is a top priority. But we really want to keep that as a priority and not some type of curtain to pass these anti-abortion measures. In 2007, 2008, 2009 is when we started seeing omnibus abortion bills. And really what I mean is that one bill would have several anti-abortion measures in it. In Oklahoma, we have a constitutional law that says a bill can only have one subject and can only pertain to one issue. So that's where you see when you hear about, oh, this bill's been ruled unconstitutional in Oklahoma. Mainly it's not because of Roe v. Wade. So we know Roe v. Wade is your right to abortion. And then we have Casey versus Planned Parenthood. And many of the cases that we see now are actually under the Casey versus Planned Parenthood model and case law, which says, like, you can pass, the state has an interest in abortion issues, and a state can pass measures to restrict or to really, what's the best word, to monitor abortion. However, those restrictions cannot place an undue burden on a woman or an abortion provider. And that's where you see all these bills really coming from under this Casey versus Planned Parenthood model. So when you hear about a bill being struck down in Oklahoma, it's either due to Casey or it's due to that specific law had several subjects in it, and so it was unconstitutional based on the Oklahoma Constitution's single subject rule. So all this thing that's really important to know. But as in 2010, when we saw a shift in the legislature from going going more conservative. Oklahoma has always been conservative, no matter what party has been in charge. However, what we did, why we did not see a lot of abortion bills, kind of in the 90s, early 2000s, mid 2000s, was really because we had leadership that did not want to hear these bills, understood that the premise of these bills really was about curbing access to abortion. And so we had leadership to really say, hey, these bills are not going to make it through. However, because of term limits, however you feel about term limits, and because of just the change of the political environment, those legislators were either term limited and left, or they were not reelected. So that is why, since for the last decade, we have seen the anti-abortion bills become very, very prevalent every year. At least having 2 to 3 anti-abortion bills a year being passed and signed into law. One great thing I do want to, not great thing, but one thing I do want to mention is that why it's important in Oklahoma really is because Oklahoma is the breeding ground, is the testing ground for these anti-abortion measures. And I'm very fortunate that I get to kind of speak across the country a lot of times working on several issues. But what I always say is, like, what happens in Oklahoma, we're going to see it nationally. Therefore, it's really important that national organizations and other states kind of pay attention to what's going on because they're going to see it. Last year, we had a bill no one ever expected that would prohibit the most common method of a second trimester abortion, a D&E. Bills that we were racing between us and Kansas to see who's going to be the first in the law, or first in the country to pass it. We were second. But now we see those bills in several states. So it's very important to monitor what's going on in Oklahoma because other states are going to see it and figure out and call us to figure out how to oppose those bills at the legislature. And then Senate Bill 1552 might be something you've heard of, where it says any doctor who performs an abortion in the state of Oklahoma will have their medical license revoked. And so it's just not saying like a current doctor that's practicing. If an out-of-state doctor wants to come in who has performed an abortion in the past or performs abortions currently, he or she could not obtain their medical license to practice here in Oklahoma. And even if they were just practicing something completely unrelated to reproductive care, it could be denied that license. So now we continue to go after doctors. We continue to go after healthcare professionals. We have a great Oklahoma State Medical Association that comes out and says, you know, we don't have a say on one way about abortion, but when you are focusing on criminalizing doctors is when we have to step in and support our doctors. So that's why I think it's important for the work that where y'all are as far as in your careers and about to be careers is that reproductive justice is such an important part. Reproductive care is such an important part of everyday lives for women that it's really men and women. So that it's really important that we have people that are supporting reproductive justice really in those fields. Because, as you know, we have bills that allow for, if you feel one way strongly about it, you don't have to provide contraception to, women who ask for it. So I know that your topic is punishment versus healthcare. I think the overarching theme to any of these bills, whether it's to require admitting privileges, whether it's to require an ultrasound, whether it's prohibiting the off-use label of RU486, is that the punishment really isn't necessarily toward women, which it seems like that is the goal. It is what it does, it pits women, low-income women, that do not have means to go out of state against women that do have access. For many women in Oklahoma, they are able to travel to New Mexico or Arkansas if they are looking for abortion care because they're unable to get it here. For low-income women, they do not have that luxury. So when we continue to talk about the safety of these bills, or we hear legislators talk about this is helping women in certain ways, we really need to know about what that help means. It means women that are forced to take time off their jobs, find babysitters, travel long distances for abortion care that is constitutionally given to them. That is why we talk about the punishment really is focusing on women that have access to go other places and then the women that don't. So I'm going to stop there. There is a great little flyer to talk about all the abortion bills we've seen in the last about decade or so. And we will have time for questions after. So thank you.
That was great. It's hard to follow Tamiya. My name's Caro, Cado, however you pronounce like corn syrup with an A. Yeah, so that's my name. My name's Carolyn Channing, and my paid work is with provideaccess.org. So I'm the Oklahoma State Coordinator, and I've done about 20 trainings in the past 10 years with healthcare and social service providers, specifically about making referrals for reproductive health around unintended pregnancy, and trying to connect folks, women and pregnant people of all genders, with abortion care if that's something that they're seeking, while respecting workers' rights to not talk about that at work if they don't want to, right? And so being able to support a workplace in making referrals. And my volunteer work is that I lead the Oklahoma Coalition for Reproductive Justice, which is a broad network of folks. We have about 2,000 members across the state of Oklahoma. And I'll pass around a sheet if you'd like to join our email list, or otherwise just follow us and the work that we're doing. And much of our work, unfortunately, is focused specifically on abortion rights. So in the context of that framework that Tamiya laid out, we are a reproductive justice organization, and unfortunately a lot of our time is spent fighting these bad bills at the Capitol. And so that list there is all of the abortion-related legislation that's been passed, and each of them are listed as, because a number of them have been overturned. So we have passed the most restrictions in the country, but we don't actually have, it's close, but we don't actually have the most restrictive laws, because a lot of times we fight in court and we win. So that's pretty exciting. If you would like to know more about that, ocrj.org. Yeah. What I wanted to talk to you about today is something that sort of bridges both of my work, and is a little bit less related to abortion. And specifically, what I'd like to do is just tell you a couple of stories about folks who are pregnant and their interaction with the criminal justice system in Oklahoma. So last time I checked the stats, at least, Oklahoma incarcerates, is fourth in the nation. And of course, the U.S. is first in the world. So we're fourth in the nation in the incarceration of men, and first in the incarceration of women. So we lock up a lot of people. And we lock up a lot of people that we're just sort of mad at, and not folks who pose a danger to others. So the first person I'd like to talk to you about, and the only person I'll name, is Teresa Hernandez, who lived in my neighborhood in Oklahoma County in South Side, and in 2004 was arrested for first-degree murder following the stillbirth of her child. So she experienced miscarriage and stillbirth at 32 weeks of pregnancy, and because she tested positive for methamphetamines, even without any scientific evidence connecting that to the cause of her pregnancy ending, she was arrested for murder. And anecdotally, when they came to arrest her, she said, "Who died?" Right? So who has been murdered, right? So this is in 2004. She was held in Oklahoma County. I'm sorry, I can pause for a second because like I just see some faces and like I feel really frustrated and emotional about this. So I can breathe for a second. Yeah. Okay. She was arrested in 2004. She was held, and this is not terribly uncommon, just with scheduling, right? She was held in Oklahoma County Jail for 3 years, waiting for her trial. Yeah, and so I don't know how much you know about you or your family's experiences with criminal justice, but the conditions of jails are pretty different than the conditions of prison, right? So there's much less opportunity to do anything, go outside, talk to people, right? So 3 years in county jail is pretty horrific. And then, due to a plea, she was convicted and sentenced for 15 years in order to specifically avoid a life sentence in 2007. And through a lot of advocacy, primarily from the National Advocates of Pregnant Women. I'm creeping in my video. Yeah, sorry about that. So advocates for pregnantwomen.org, or NAPW. And we had community forums and really talked about some of these really unexamined assumptions and beliefs that we have. I imagine we have a little bit of difference in age, maybe. I was born in like 82, and so when I was little at least, and I was growing up in Southern Ohio, like we all called each other crack babies because that was like something that was in the vernacular and that we really sort of talked about and demonized this phenomena. And there's just not the scientific evidence to support that the long-term outcomes for people who were exposed during pregnancy to cocaine, to methamphetamine, are any particularly different than those who aren't. And that's pretty surprising to me because I certainly grew up with that belief that this is an epidemic. And in the press, it was just horrible. You know, they call her meth mom, and it was really, really in a way that focuses on the punishment and what should happen to someone, right, who has done the horrific, the unimaginable of still having a substance abuse problem while being pregnant. This is an exciting story because she was released only a year after her sentencing. And it kind of doesn't happen this way, that even if you're up for commutation or your sentencing is under review, but she was released in court, they apologized, because it's kind of absurd. And so at least since her arrest in 2004, no one in Oklahoma County has been arrested for murder because of a stillbirth. So it's almost a little bit of a hopeful story that I'm telling. The thing that upsets me the most about this is the idea of drug testing being the cause of arrest, if that makes sense. And because I think that very deeply disincentivizes prenatal care. And certainly, so just, pardon me, I'm pausing because I'm like, should I just tell you guys I'm pregnant? I will just tell you. I'm like 14 weeks pregnant. I have a button, cover up my, anyway, having some GI issues because I'm pregnant. And folks who have access to different types of prenatal care and access to different types of providers are drug tested or not, right? Even this early in pregnancy, and certainly at childbirth, as to whether or not it's a suspicion or it's a standard practice. And that can be really, really deeply discriminatory. So then to tell just a couple stories about reproductive health access in prison. Because of my work, a friend of a friend contacted me because she was asking about, where someone could obtain abortion and how long they could wait. And so I was telling her, and she said, well, this friend of a friend really has a wanted pregnancy, would like to continue, but is worried because she's in a halfway house right now. And so to be in, to have left prison and be in a halfway house situation is following the rules of that housing placement is essentially a condition of your parole. So violating any of their rules, and many have rules about romantic relationships, rules about behavior and how often one has to attend Bible study, curfew laws, rules, a lot of rules that exist in these kind of housing placements. And so she was just worried because she was also experiencing some GI issues, you know what I mean? That she wouldn't be able to successfully conceal her pregnancy for the next 4 weeks when she would get out of the halfway house. So she was considering terminating her wanted pregnancy because basically pregnancy would have been a violation of her parole and could send her back to prison. So that's creepy. That's not right. I was telling a friend about this, and who had previously worked, if you're in prison in Oklahoma, if you're incarcerated and you're a woman or a pregnant person, you're transferred to Mabel Bassett, which is a specific correctional facility. And I believe that everyone who's pregnant and at Mabel Bassett and delivers their pregnancy to term delivers at OU. And so folks who are incarcerated have a very specific trajectory, right? So most people, once they are transferred within the system and arrive at Mabel Bassett, are far enough along in their pregnancy that abortion in Oklahoma is not really an option for them. However, occasionally, folks are early in their pregnancy and are pretty vocal about wanting to terminate their pregnancy or not intending to be pregnant. And so this is a friend of mine who was telling me a story that, oh yeah, and the scheduler just said, well, I'm not scheduling that. So what's the opportunity, right? So how does someone access reproductive health services while they're in prison? The final story that I'll tell you is something that I did a little bit of work on earlier this year, and I'm hoping that our work with OCRJ in connection with the National Advocates for Pregnant Women will be able to put this information together better in a way that is able to support family members of folks who are incarcerated that are trying to connect them to medical care, or at least trying to understand why they're not getting any medical care other than their blood pressure checked. And so this situation is someone in a rural Oklahoma county in a smaller city who was arrested with a large group of folks and charged, I believe, maybe with possession and distribution or manufacturing of controlled substances. And she was about 6.5 months pregnant at this time. And it took a lot of advocacy, and we called many times. But it took a good 6 or 7 weeks to get her reconnected and established with prenatal care, which still was just, I don't mean to be rude about telemedicine, because telemedicine is great, but was a video call with a nurse in Oklahoma City. And that took 7 weeks for her to get on the phone with somebody just to say, are you still pregnant? How's it going? And so the idea that a lot of these county jails now are, in the past 2 years or so, have transitioned to receiving their healthcare support through telemedicine from a contracted company is just a really interesting thing that I'm learning a lot more about, and I'd love to work with you guys about if you want to know more about any of these topics. It was great to talk with you. I have buttons too. I'll pass around buttons.
Hi, I'm Shannon Speidel, and I am an ordained minister with the Christian Church Disciples of Christ here in Oklahoma and nationally. And I am an associate minister at Central Christian Church in Enid, Oklahoma, which I believe is the #1 county for teen pregnancy in the state. So go us. In addition to being on the board of OCRJ, I am also a part of the Faith and Reproductive Justice Leadership Institute with the Center for American Progress, which is in Washington, D.C. That really affords the 20 of us who are in that group the opportunity to work nationally. And my passion is to change the faith voice around issues of reproductive justice, because especially in this part of the country, those are the voices that are dominating and yelling loudest, and they're usually just vindictive and hateful and counter opposite to everything faith communities are supposed to be about. So that's my passion, to be a different voice in the conversation. So, in my opinion, and I bet these ladies might agree, a lot of the undercurrents of what we're seeing as pushback from reproductive justice is rooted in a morality, or what is a person's perceived morality. So our legislators and the people who protest, vehemently, and they are all working from this morality undercurrent, and often from their faith life and perspective. So separation of church and state isn't really working so well, especially in the state of Oklahoma. So the morality issues are often rooted in Christianity because that's the predominant religion here in Oklahoma, and it's often a very conservative, fundamental idea. And so we have legislators and we have, lobbyists and people who are working for pro-life movements and, trying to outlaw abortion as best they can. And we can't escape it. Even, people of all faiths, people of no faith, people, whatever journey we're on, we cannot escape that morality is a subject and a fighting force in our location here and now. Are all of you from Oklahoma? No. So some of you have transplanted into this wonderful location. Wonderful. Welcome. The work is really hard on the emotional side. And the emotional side is very fiery because people have their beliefs that are so rooted in what they have been taught growing up. They're rooted in how they were raised and what they may hear every week on a Sunday. So on both sides, on both sides of the issue, we have fire. And a lot of that exists within our morality. I'm going to keep it somewhat short because I want to engage and have questions. But I would just like to say that the way our state is functioning right now is immoral to the core. And the reason for that is because we have, a $1.2 billion deficit in our state. We have a public education system that is crumbling. We are stripping our citizens of their access to health care, specifically poor citizens. They don't have access, and that is immoral. Taking education away from our children is immoral. And not trusting women to make decisions about their lives is immoral. And so that is at the root of it all. And that is not a popular argument. When you start making those points with people, that's going to tap right into their fire. So this state seems to be all about your birth, but not your life. And that is counterintuitive to everything Christians are supposed to believe. We have an example of Jesus, and Christian or not, we are familiar with the great physician and this man who went around performing miracles and taking care of the least of these. And that is what we hear. And regardless of your faith or your life, taking care of people is the moral thing to do. And our state is really failing to take care of our citizens. So, I'm just going to wrap that up because I could go like an hour with my anger and fury, especially right now, because it's really alarming and it's really bad, and we're seeing people suffering in real ways, their life, that they don't have access to what they need. So being born is wonderful, but your prospects are maybe not so great. So anyway, yeah.
So what do you guys want to talk about? Yeah.
One question. Maybe for
Tamiya.
Tamiya, sorry.
That's okay.
You talked earlier about oftentimes how laws are considered unconstitutional way being placing an undue burden. And that seems very vague to me. So I was just kind of curious, like, how does the court arrive at a decision that this is an undue burden versus this is not? Because in my opinion, any unnecessary burden that especially does not actually protect the health of women or promote their safety is an undue burden, which I guess is probably a different interpretation than a lot of courts. And I mean, like, who gets to decide that the burden that is cast upon like certain women is insignificant, or not significant enough? That's not necessarily an undue burden.
Right.
And so I'm just kind of curious how all of that is tackled in the courts or.
Well, I think you made a great point that the undue burden, the undue burden test really is determined by past case law, but most importantly, it's up to the judge, right? So many of the cases, all the cases that we do are civil cases. So it is the judge ultimately making that decision. So it can be very strategic and political as far as the judge you pick. And it's very strategic if you want to be in state courts or if you want to be in federal court. A state court, judges are elected at the district level. So you have a politician, and not necessarily in a bad way. We think of the word politician sometimes. You have someone, an elected judge determining what that undue burden is. So I think you are exactly right. The standard really should be an undue burden is, if it's an unnecessary obstacle placed upon the right to an abortion, is that undue? And that usually is what courts are going to look at. So the courts, we have a great organization, the Center for Reproductive Rights, based in New York City, that have challenged all of our abortion cases. And what they argue, their argument is really based in facts, which is not the case all the time when we see the other side's arguments. It's really based in past traditions as far as looking at experiments, looking at the impact of a bill. It is an undue burden when you have clinics closing down, or when you have women who cannot come to the clinic because they are past this arbitrary date. So for sure, I think the judge is making that determination of what an undue burden is, but based on the case law that we have seen in the past here in Oklahoma, as well as thankfully in other states. But the really standard should be, is it unnecessary? Does it promote women's health? And that's really been the way many of these bills have been struck down, is because the state cannot show how this is promoting women's health. And the best example I have is the RU486 drug that was recently we've seen across the state. Oklahoma first saw it in 2008, I think 2007, and really it was prohibiting the off-label use. And for y'all in the medical profession, you understand, off-label use is really common for a lot of drugs, and so the off-label use that providers as well as the community has realized that you could use RU486 just 200 milligrams. You could use it within 9 weeks. The woman on the second day can actually self-administer. They realize it's just as effective in those cases because of the label use. What is printed on the label says that it has to be 600 milligrams. That it has to only 7 weeks. It's not as effective. It can only be used up to 7 weeks in some days. They get really specific, and that a doctor must administer the second drug of misoprostol. Yeah,
Or Cytotec, right?
Yeah, misoprostol, right? So, but evidence-based, right? So the evidence showed that actually it's more. You are going to have less side effects when we can only give 200 milligrams, and so. So how do you promote this is actually safer for women when women are having more side effects by the label use, right? The printed label. So this bill has been struck down at least 3 times in Oklahoma, because that's what we do in Oklahoma. When a bill is struck down, we just pass it the next year. And that gets frustrating as taxpayers. It gets frustrating as lobbyists to be up there.
Or as plaintiffs.
As plaintiffs, right. Or as just regular folks saying, again, what's different this time than last year? And usually that answer is nothing. But that's what we talk about when they're arguing promoting safety and the health of the woman, and we can refute those arguments. That's that undue burden, unnecessary. But we're fortunate that we currently have a court system that actually looks into that. That may not be the case all the time, and that's why it's really important for us to not even have to get to the court system, to be able to fight this at the Capitol. And that's what our focus is a lot of the times, but understanding that it's an uphill battle.
This is for Shannon.
Yeah.
In your position, when you talk to people like within your church or other religious people, do you find that you're fairly successful in bringing them over to the reproductive justice side? And what would be your best, I guess, arguments to do that?
Oh, Lordy. I tread lightly, especially when I'm first meeting someone. You never know what kind of religious person they are. Like which team are you playing on, though? Because, Christians are vast and whew. So I have a lot of success with people who are more moderate to progressive, who are more naturally going to be able to engage. When I am visiting with people who have their fire on the other side, sometimes it's best to just agree to disagree. Otherwise, it can get really bloody really fast, and you will walk away, infuriated with life after you have this conversation. And I've had, people standing over me, screaming at me, it's been really bad. So what we are taught, especially as you engage with these really sensitive topics, is to spend as much time as you can listening, to really have active listening with the person. And you may be boiling on the inside, but to at least appear like you were hearing what they're saying. And to then respond with some acknowledgement of what they've said. So, I hear that this makes you really angry. To affirm, to make an observation, you heard them, and to say, I just can't be in that place with you. That is not where my beliefs are. I'd be willing to visit with you about what I believe and why I feel this is immoral, and why, we need to really be engaging and taking care of people. But if they're not able or willing to just say, well, I hate that you're so angry about it, or I'm sorry that and really that's the safest, place to be, because, the fury is so widespread that it's really hard to change somebody who's all the way polar opposite and get them to come where you are. So a lot of what we learn in ministry is to meet people where they are and then journey with them. And that is the hardest thing about my job 90% of the time.
And can I just add,
Yeah.
Shannon, that and I think some ways to kind of help with that is to find where you do agree.
Yes.
Right, because we may disagree on abortion, but maybe we do agree on that all women should have access to prenatal care, and that very much is a reproductive justice issue, right? So if we can find, and I use that a lot. I didn't realize I use that a lot because at the legislature, when I'm talking to legislators, that a lot of the times I have to find out where's our agreement in, and maybe we don't touch those, or maybe I can tell you why the reproductive justice model, the reproductive rights model is so much and always will be much bigger than just abortion care. And let's get there, right?
Yeah.
Yep.
Yeah. Hey.
If it is not political, can we cut down the support, like 90% support cut down for this teenage pregnancy and taking care prenatal, postnatal? This year I pay $8,000 Medicare, Medicaid, $8,000. I cannot give my daughter and son. And paying the folks who is not contributing a single penny to U.S. government, $3 trillion debt. $3 billion cut down for the education this year. And we are pouring that money that side. So what is, you can answer for that?
Go with the economic side of it.
Yeah, I guess, so is that, yeah, I guess I'm thinking about Medicare expansion, right? And so,
Yeah.
so there's certainly money on the table that Oklahoma hasn't been willing to use to support
We are
Yeah.
paying for nothing.
That's right.
Yeah.
Immoral.
Everyone, here sitting, everyone is paying.
Yeah,
Right?
yeah.
For sure.
So we have to cut down it. If you will cut down, they will start this
Go start listening.
teenager pregnancy, like teenage.
Right.
8 years ago, Oklahoma published, in it, sex is only fun, nothing else. What? Sex is only fun in it?
I hope not.
8 years ago, I'm talking about. It
Yeah.
was big news in Oklahoma.
Yeah.
Right.
So
Right.
we
But-
have to think.
But I think that's such a great argument as an economic issue that we try, but sometimes they go back to the moral issue. Because for every dollar spent on family planning, the state's going to save $9, and that money is from just not being on Medicaid, the cost of Medicaid, from any other type of government services that low-income families may have. We tried to get that out there, right? Like, you're not going to listen to me from why this is wrong or why you need to support these issues. So I try to come at you this way. And then they get it. They understand it, that like if we invest in Oklahoma, it saves Oklahoma money. Regardless, not just reproductive care. I mean, regardless, we're investing in our students. They're going to stay here and help build the economy through their innovative ideas. But, I think part of the problem is that they are elected every 2 years. So as soon as they get elected, they're thinking about their next campaign. So if I can keep it real with you, and I hate to get political about it because these are important issues. But so it's our priorities. And how do we get our priorities in line? And that's where I think y'all come in. Like, you talk about, I'm going to stay in Oklahoma because I'm invested in Oklahoma, because I spent all this money to go to school here, and I'm going to stay and make sure I get a return on my investment. And I expect you as my legislator, as my policymaker, to invest as much as I have. I mean, if someone has a better idea, let me know. We're all looking.
Well, and the economic issues are linked into every single branch of reproductive justice, right? So if we are not giving our teenagers comprehensive sex ed, and they are having sex because it's fun, and then they're pregnant, and then they're going to need a whole lot of support raising a child that they may not have the means to do because they're 16. And so that is an economic issue linked to education. And we are punishing ourselves as a state, and we are punishing teenagers in that regard. And so there isn't any piece of reproductive justice that doesn't have an economic implication. Of course.
I kind of have a question. I'm sorry.
Yeah.
So I'm kind of in a limited environment. I'm around people around my age and stuff like that. And I think most of, at least my peers, are pro-choice. So do you guys, in your experience, see that the older people get, the more conservative their ideals, or it's a generational thing where you think the climate will shift as the aging demographic changes?
So I think that's a really dangerous mindset. I hear what you're saying,
Yeah.
and I totally have had that perspective. And so, yeah, but I think it's really dangerous to think that, well, things will just get better when they die. And I mean that really, I mean that in the kindest way possible.
Dying off.
Certainly, the leaders of OCRJ and the founders and so many of our supporters are older than my parents, are folks who were around, who knew what specifically with abortion rights, right? Who knew people who died, who were doctors, who were interns prior to Roe versus Wade, and they'd see one wing of folks recovering from childbirth and two wings of people not recovering from illegal abortion. So I think older folks are some of our best allies, specifically with respect to abortion. Because I don't know about any of you, I don't know anybody who's died. because of a self-induced abortion. But my grandmother can't say that, right? I also think young people are conservative too, right?
That's
like
right.
I just don't talk to them, right? But like there are,
I don't know them, right?
Well, I talk to them.
You know.
okay, all right.
Or rather, they talk to me. But I think it's more of a social location thing than a generational thing.
Okay.
You know, I think that we are in this cultural hub of, crazy conservatism. I say that mumbling because there's a microphone. But
Shannon said that.
Yeah. But I really, because I have been all over the country. My husband's in the Air Force, so we have lived, but I am native Oklahoma. So it's not like this everywhere. And I think what we're seeing are younger generations being taught by their social surroundings. And unfortunately, it's just where we're at.
Kind of second you on that because I grew up crazy conservative.
Yeah.
Still, like I used to be that person. And I don't know what Oklahoma was so much different from Texas. I think it was just the people I was around, but it's like I shudder at that person. Like I don't want to acknowledge that person.
And what
But
changed for you? What was?
I think I got out of the Christian school that I was required to attend and
Ah.
parental obligations that I grew up in. I was like, well, I mean, you're not going to drive me to church if I live 150 miles away. And kind of get a different perspective. I had friends that did not grow up upper middle class, white, at a Christian school. So you kind of learn like things that your parents have told you, like my mom this morning was like, well, you can just drive to another state if you need an abortion. And I was like, well, that's really handy for me. And I said, well, what about all of these other people?
That's exactly
And
right.
she's just like, kind of ignores it. And I'm like,
They don't matter.
it doesn't affect them. It doesn't
You
affect
should
my
remind
parents.
her that Jesus reached out and took care
She's not very religious.
of people.
My dad is though.
She's not
No,
religious?
they not anymore.
Oh.
But yes, my father still is.
Gotcha.
Well, the thing that I would bring up then is the Hyde Amendment. So,
Yeah.
both the Hyde and the Helms. But when Roe versus Wade passed, one of the first sort of anti-abortion laws that was passed was prohibiting any federal funds from going towards abortion. And so that means Medicare can't cover it. Medicaid can't. And, yeah.
In certain circumstances, right?
In certain
Yeah, yeah.
circumstances.
Very,
so,
right.
Yes. And certainly in Oklahoma, at least.
Right.
Yeah.
I had a question. So you said there were only 2 abortion providers in Oklahoma?
Mm-hmm.
So those are the
Only providers. We have Dr. Burns, and then we have Reproductive Health Services in Tulsa. And they've got 2 providers on staff.
Yeah.
Right. So 3 providers.
3 doctors, 2 clinics.
Yeah, 3 doctors,
So
2
what
clinics.
about like the women in Western Oklahoma? I mean,
Right. That's a great point. So we have a whole span of Oklahoma that does not have access. And so one of the things that I think it's very important for us to say is that when women do not have access to terminate their pregnancy, does not mean they're necessarily not going to terminate their pregnancy. So we get a lot of calls just in the community as far as like, how do I terminate with what I have at home, with the drugs I have at home? Can I get RU486? I can go online and can I purchase it online? And by all means, I don't ever want to be put in a position to say, we know women are self-inducing. After the Texas law, I don't know how familiar you're all with the Texas law, that complications from self-inducing went up significantly. When we were actually, and I think it was last year, when we were actually in Tulsa talking to reproductive services doctors, one, and I don't want to say she was young because I don't know if they ever said, but one woman found online that if you mix like vitamin C and vodka, like that would terminate a pregnancy. And so, it does not.
By the way,
work.
don't do that.
No, don't suggest that. So they were seeing her for complications of self-induction, right? So when women do not have access, they turn to other means, and that's when we talk about the importance of safe and legal abortions in Oklahoma. But most importantly, that rural Oklahomans should have the same access as Oklahomans in Oklahoma City, Tulsa, Norman area.
Just to piggyback off of that, the World Health Organization, and you can find this information at womenonweb.org, does have information about how to use some pharmaceuticals for self-induction safely.
Are there programs that offer to ferry women to these locations?
Not in the U.S. that I'm aware of.
So there are only 2 locations, but nobody is offering.
Oh, ferry. I understand what you're saying.
You're talking
about
So
women on waves.
transportation for
Yeah.
yeah, I was thinking. Never mind. That'd be great. You want to start it? Let's do it.
You know, and so we used to have what we called the Underground Railroad
Yeah.
for women that needed access to abortion past what doctors were doing 20 weeks. So actually doing transporting women to see Dr. Killer in Kansas. But we do not. We do have a row fund that will help women that need abortions. But this idea of like, how do we, you know, there is not an Uber for abortions right now. And that is something maybe we should
That's
think.
a good idea.
Wow, stop talking. We got the.
No,
We need
it's
to
the big.
figure that out.
I think that the Cicada Collective in North Texas is a really good model, or maybe that's the group that is affiliated with the North Texas Abortion Support. I'm not giving good citations, but like email me. I'm at Carol like the corn syrup at ocrj.org. Let's make a plan.
Well, yeah, because I know they have plans to take voters to like voting
Yes.
locations. So
Yeah?
that's something similar to that.
Right? I got an extra room at my house, you know? I mean, like, yeah. I think this practical support, I think that does so much, well, that's okay, I can say that. I think that does so much more than some of the legislative work,
Yep.
some of the judicial work. Like, that's what really provides support for folks, right? Yeah.
Do we have time for one more?
Mm-hmm.
This is kind of on behalf of the nurses. I know that several states have laws that allow advanced practice nurses to be abortion providers, and Oklahoma, as far as I know, does not have a strict physicians-only law. It's just kind of a, do they?
Yeah, I think we
Okay.
do,
But
yeah.
not many states don't. It's just kind of a de facto situation where only physicians perform abortions. So what can advanced practice nurses do to kind of circumvent that or become providers? Because just like with primary care and all these other roles where APRNs are filling the gaps, how can we step up in that area as well?
That's legislative work, but I'm so glad you said that because at our clinics we have 3 or 4 advanced practice nurses, and we talk about doing the same work as our medical director, who is an MD. But that is great work. And in Oklahoma, as we know, the shortage that we have on PCPs and the shortage that we have on doctors already, that it's just necessary for nurses to take on more significant roles. And that should actually also carry over to clinics, abortion care clinics as well, to be able to take on more significant roles. So unfortunately, that has to be done legislatively, but that is stuff we could definitely work on. We're definitely interested in working on that.
Yeah, and so I think something to go along with that, and I know we've talked about this specifically, there are a few states in the West Coast, and my organization, organization that I work for, Provide, was instrumental in our previous work in laying some of the groundwork so that advanced practice nurses can provide care. Some of the specific targeted regulation of abortion providers or TRAP laws that probably intersect with this issue would be, for example, in Oklahoma, we have a law restricting use of telemedicine for abortion. We have a law specifying that medication abortion can only be provided in a clinic set up to do surgical procedures. And so there are states that don't have those restrictions, and that would be, some maybe fertile territory. There was a third one that I thought of. Oh, the physicians only law. Yeah, cool.
Does OCRJ have a list of people running for state Congress, anything like that we could vote in so we could move on from these issues that should have been handled a long time ago?
Nice, I love it. So we are a 501c4 so that we have the capacity to do that. Let's talk about a candidate survey. We've had some buzz about it. We thought last year maybe we shouldn't do it this year. In 2012 we had a candidate survey, and at least a couple of the people that we wanted to endorse were like, could you not tell anybody? So we were like, is it going to spin our wheels to do that, right? Yeah, Oklahomans for Life has one that probably gets you some similar information, right? Just the opposite side? Yeah. That's my push. Not to plug them, but that'd be my data source right now. Yeah. Thank you guys so much for spending your lunch with us.
Thank you.